Hi, my name's Dr. Marcus Spry. I'm a dentist in the United Kingdom and I run a practice here. Composite and porcelain veneers. What is the difference and which should you choose? Well, basically the reason why a patient might choose to have a veneer is that they are unhappy with the appearance of their smile, and the veneer will allow a covering of the tooth which will make it look better. So that's the reason why we do veneers. It may be your teeth are a little irregular in position, or it may be that they're not the right shape, or it may be that they're not the right colour, and that can be improved by putting a covering over the top which will change it. But the thing is what is that covering going to be made of? And traditionally that covering would have been made from porcelain, which is made in a laboratory. And as a result, there is a visit for some preparations, and then you have a temporary, and then the impressions go to a laboratory where they make the veneers, and then you have a second appointment where the temporaries are removed, and then the proper veneers are glued into position. And that's porcelain. But what we can do nowadays is to put a composite material which is soft when it's applied, and then a light is shined at it and it activates the catalyst in the material and it sets. So you can have material added to your teeth which will be done in one visit, and that is a composite veneer. The tooth may need to be adjusted, in other words it might need to be drilled a little bit so that that can be facilitated, but in essence the material is a composite material, the same that you would put into a hole in a back tooth, but it's made in a flatter shape for a tooth. And it might be a bit easier if I do some drawings of that for you, and then you can have a little understanding of what exactly that is. But the difference is, one is made out of composite material, takes one visit, the second is made out of porcelain, which takes 2 visits. Porcelain will be probably the best and will be probably the most durable, but will probably be the most expensive, and the composite will be done in 1 visit and won't be quite the best way of doing it, but it'll be less expensive. So there is the issue between the two. At the end of the day, you have to decide and you have to talk to your dentist and make a decision. But I'll draw you some little pictures, and then it'll be clear what sort of things that veneers can do.
Okay, so I think the first thing to do is to have a little look and see, generally speaking, a central incisor sort of looks like that normally. Okay, and then so that's your normal, the midline is here, and then your second incisor, we call it the lateral incisor, is a slightly smaller tooth, okay, which looks like that. Okay, so there's definitely a sort of step downwards here. Okay, so just do that, and then the canine tooth, which is the sort of Dracula tooth, is pretty much at the same sort of level, but it's quite a bit of a bigger tooth, and that's kind of how the teeth should be. Now the problem is that sometimes this tooth here might be quite small, so if we imagine that tooth there was really quite small, I mean sort of like that, with a bit of a gap there, then that tooth would be suitable to having a veneer. So you could remove a little bit from the front of it, and then a porcelain facing could be made to build this up to the point where it should be. So all of that front area now would be in porcelain, which would build that tooth back up to looking quite nice. Okay, so from the side of the tooth, if you can imagine, we've got the tooth like that, and then we've got sort of, and that goes up into the root. We would need to remove a little bit from the front of the tooth and from the top. That would need to be drilled away, and then that could be made, this area here could be made in a porcelain or in composite. So that would be the shell of the material that would fit over the front, and that could either be made in composite or in porcelain. Personally, I like porcelain because it's durable and it is the best looking, and it also is the most easy to produce. If you're trying to make this in composite material, trying to manipulate the material, it can be quite difficult to do. Alright, but basically we're going to have to remove a little bit of the tooth so that there is a sort of window ledge, a sort of area for the veneer to fit into. Alright, so that's basically how veneers work, whether they are porcelain ones or whether they are made in the mouth in composite.
Thanks for listening. Please like, share and subscribe. Click on these boxes for more of my videos for a smile for life.